I remember when I was younger, I started experiencing chest pains, and I thought maybe it was just puberty or growing up. But then I noticed that like the pain had gotten a little bit more severe, and I had it for a couple years. I remember my mom thinking um, it was just testosterone, or I had other people tell me that it was stress, and I just didn't. I was just like, okay. I was like, well, if that's the case, I'll just kind of wait it out. But then it never went away, and it continued to happen. I went in to see a doctor after a while because something didn't feel right. It didn't. I couldn't sleep at night feeling like everything was okay. I went in to see the doctor, and I had seen several doctors, ran several tests, and the end result was that they told me, they're like, well, congratulations, you're one of 22% of men in the world who has breast tumors. I just remember kind of laughing. I was like, what? I was like, men can get those? Based on more like testing and stuff, and they ruled out cancer, which was one of my first concerns. Because when they tell you have breast tumors, you just really don't know what to expect, and then you want to ask a bunch of questions, and they don't really have them right away most of the time. Um, so I had two masses in my chest. One of them, they what they wanted to do is they wanted to take them out, but they wanted to do it in 6 month intervals. So they wanted to take one out, and then 6 months later take the other one out. So I got scheduled for surgery. It seemed like it went smooth. They said that when they got in there, it was actually much larger than they anticipated, and it was putting pressure on my ribs, which was part of the problem. Part of the pain I was feeling was it was just kind of it was putting pressure on my chest, and I was like, okay, thank you. Like I was glad because a lot of the pain had gone away after that. And then 6 months later, I came back in and we scheduled the next surgery, and after each of these surgeries, whether it's a small surgery or a big surgery, it's a lot of times when you have surgery, you have like fluid buildup afterwards. So I just remember both surgeries having to go back in for like a couple weeks. I have to go in. They have to lay me on the table. The surgeon would put like a bunch of needles in my chest to numb it, and then they take like this, pretty much like this turkey baster, this large needle, and they go in and they pull out all the fluid, and it's pretty much like draining it. I'd have to have it drained for a few weeks after the surgery, like every few days. Um, and I had the second surgery 6 months later, and it seemed like it went smooth. And I felt great because the pain was gone. I didn't have the pressure. I wasn't too worried about it at that point. The doctor said that because it's not cancerous, but still a tumor, it can still grow. It's a mass inside your body. It can either stay dormant or it can grow. And I told him, I was like, okay. I was like, well, I was like, if we gotta do another surgery, we gotta do another surgery. At that point, I was kind of starting to get used to it, which is kind of terrible. And I remember I went in, we did the third surgery, it went smoothly, and there wasn't a lot of pain. Um, I just remember that I was thinking I was out of the woods, so I now had three chest surgeries. Thought everything was cleared up. They told me I was good to go. Um, I remember I came home and I was staying with my parents at the time. Luckily, I was living with them. Otherwise, I had to have someone help me because after you have chest surgery, it's really hard to use your muscles and stuff for a while. Just because the mass grew in between the muscle, so there was weakness afterwards. I remember I think it was the second night I was home. I had to take medicine every 4 hours to help with the pain, and I woke up in the middle of the night in just a lot of pain, like severe pain, like someone was punching me in the chest. I had a hard time breathing. I was not really gasping for air, but I was trying to hold my breath because I felt like that the pain was so intense when I was breathing. I would hold my breath as long as I could at times, just to kind of keep the pain away because it really only hurt when I was breathing, and that was really hard to kind of deal with, understanding that I say it hurts to breathe. And I was just like, there was a period of time where I didn't want to breathe and I didn't know what was going on. Um, and I wound up going into the house. I told my dad something was wrong, and he was like, well, he's like, well, we'll just check with the doctor in a couple hours, just make sure you're taking your pills. And I took my pills. I originally thought that was the problem, and when I went to the bathroom and lifted up my shirt, my the skin was black and blue, and it was really like tight, not like your normal skin when you touch yourself, but it was just really tight, and I couldn't. I had a hard time with dealing with what I saw in the mirror. Um, we made some phone calls. We did a few things. Later on that day, when I went in to see the doctor, um, they did their normal procedure. They tried draining my chest, and he put three three syringes in me, and nothing came out in either of them. And he thought it was a little weird. I just remember laying on the table and him looking at me, telling me, he's like, Jack, he's like, I'm sorry, but we gotta schedule an emergency surgery. I think you have internal bleeding. And at that point, everything kind of hit me. But I went home and I had to talk to my parents because I had to have someone with me in case anything happened. They wouldn't just do a surgery with you by yourself. And um, I remember my dad taking me, and then I woke up that evening, and I just remember my dad sitting in the hospital room with me watching football. But I woke up that evening, and I didn't know what was going on. I just remember coming out of anesthesia and was like, okay, like I woke up, I'm alive, so that's a good sign. And I just kind of was like, well, we'll kind of see what they say. And then, like an hour or two after I was awake, the surgeon came over to talk to me. He kind of filled me in on what was going on, and he told me, he's like, Jack, he's like, I'm sorry. He's like, you did have internal bleeding. Um, we accidentally cut a vein or something on our way out when we were finishing up the procedure, and we didn't catch it. Um, and I just remember thinking, like, wow, I was like, this is like 2 days since the last surgery, and, well, 2 days since the third surgery, and I was like, I was bleeding for 2 days. I was like, well, I mean, it explained a lot of things, but I was like, holy crap. I was like, I could be in bad shape. I had no idea. He told me I was laying in the bed, and he's like, you had internal bleeding. When they went in, he told me that they had to. Uh, he told me when they went in, they had to clean it out and cauterize it. And what they found when they went in was that I had developed a blood clot in my chest. And if we would have let it go, and if I didn't notice that something was wrong, and if I didn't go to the hospital, it could have, in the long term, it could have wound up with me having a stroke. And I was like, what 21, 22-year-old wants to go through life having a stroke that young, not knowing how it would affect them the rest of their life? And I just remember kind of being thrown back after everything was said and done. I had, at the end of it, I had 4 chest surgeries, one of them being emergency because of an accident that happened. And I didn't blame the surgeon. I didn't blame anything that they did. They did everything that they could, and I understood that accidents happen. But I just remember sitting there thanking God that it was recognized soon enough before it became anything really severe. I mean, not wanting to breathe, the bleeding, the pain, everything was hard. I think it was like 6 months of healing, because there was a few weeks where I actually had to have my arm in a sling, and they had to leave my chest open. They had to leave a little drain tube on the side, um, so that way the fluid could drain out freely. So I had just this big patch on my right side for a while, and it was kind of funny because I was like, it kind of looks like I got shot. A lot of people were like, "What happened to you?" And I was just like, I really don't want to talk about it. It was just one of those things. But I just remember laying in the bed after he gave me the news on the 4th surgery, and I just remember thinking, like, I just I had no idea, after surgery after surgery after surgery, and then after the 4th one, I didn't realize how precious your body is and how sensitive or fragile it is. And it really kind of woke me up. I mean, I thank God that He was able to help put things in place so we could get taken care of on a timely manner. And I prayed that I would heal good. I mean, now I've got no tumors. I'm healthy. It hasn't been an issue. It's been several years. But it's just something that I reflect back on, that I just, I realized that if I wasn't praying and if I didn't have my head focused, and I felt that kind of God put everything in place to kind of help me like realize how important we are, but how fragile we are, and how it doesn't take much to destroy our lives. Whether it's something we're doing to other people or whether it's something that happens to us. I didn't realize that anything could really happen. I was still young and I was like, I'm going to take on the world. But it was through these events that I helped kind of start it, helped bring me closer to God, because I was starting to realize the time that we have with family and friends and how important everything is. Because if I wouldn't have had this surgery when I did, how I did it, and if they wouldn't have recognized it, if I wouldn't have called them feeling concerned, I could be way worse off today than I would have been how everything fell into place. And a lot of people can just say, well, you did the right thing, well, you did the smart thing, you thought about it. But for me, it was like, well, it's like I woke up in the middle of the night randomly, and I'm not one to wake up in the middle of the night. I'm not one to wake up for even an earthquake. So it was just, there was a lot of things that I felt kind of God put in place, and it was kind of a wake up call showing me that, hey, your life is important. Your life means something. Don't waste it. Don't throw it away. When something's wrong and you feel something's wrong, or I feel like if God, like, if He presses on you something's wrong, then spend some time thinking about it, spend some time trying to work on it and seeing what's going on, because you never really know what is actually the issue. And I felt like God took a hold of my heart and told me that it was something I needed to get checked out. And I thank Him every day that I'm still here, that I'm breathing normal, that I'm fine, that my chest is healed, and that I can just feel rest assured knowing that God helped guide me through this, and that He put the people around me that needed to be there, like my family, to take care of me afterwards when I was in the sling and everything, and when everything was going on. Um, it's just one of those things that sometimes, like, it's hard to talk about a man having breast tumors, but for me it was just kind of, it was just, I'd never thought that was what it was, and I never thought I was going to go through the situations I did. But 2 years later, after 4 surgeries, I really felt God showed me the value of life and the things that He has brought to us and the things that He calls us to do in our lives, and just to cherish the time that we have, because you never really know when it's gonna when it's your time to go home.